I've been working at the hospital since 2010 and participated in its foundation. My focus and area of responsibility include minimally invasive surgery, particularly in the ankle, knee, and shoulder joints. I used to conduct researches in this field, specifically in the study of growth factors and stem cell therapy. I was also involved in the treatment with cartilage cells and methods of regeneration of the connective tissues and joints. Later, I specialized in this focus at this hospital within the framework of private medical practice, performing the entire spectrum of procedures with the assistance of my colleagues. Moreover, my area of specialization is shoulder and knee joints, as well as regenerative therapy, including stem cell therapy. My area of specialization encompasses regenerative therapy and stem cell therapy. These focuses, especially combined with minimally invasive techniques, rank me among the leading specialists. And I should say my university education and research in this field have also contributed to it. There are several options of regenerative therapy. I would like to highlight stem cell therapy. The stem cell therapy is provided on an outpatient basis. This means that the patient comes to the hospital for one day. The procedure is similar to conventional plastic surgery, during which fat cells are sucked out from the adipose tissue in the abdomen, but it is outpatient. Consequently, the patient needs only local anesthesia. Then these cells, including stem cells, are processed, i.e. stem cells are secreted from adipose tissue when multiple centrifugation is followed by the dissolution of excess tissues, so that at the end of the entire preparation there remain only stem cells. During the outpatient surgery, these are injected into the patient's affected joint. The entire procedure lasts about 3 hours and includes stem cell extraction through the suction of the adipose tissue, as well as individual steps of stem cell separation and stem cell extraction from the tissue, while the injection takes only 5 minutes. No, stem cell therapy can be provided in a single session, but you should keep in mind that it will last 3 hours. The goal of stem cell therapy in arthrosis, i.e. in case of arthrotic changes in the joints, is to slow down this process and, better still, its subsidence. The action of stem cell on the arthrotic joints aims to interrupt the inflammatory reaction, which causes pathological symptoms in arthroses. Certainly, this can also be achieved with the injection of ordinary drugs. However, the effect is significantly reduced and limited in time, whereas with stem cell injections we interrupted inflammation for a much longer time, up to several years, depending on the degree of arthrosis. So, at an early stage, young patients have a well-preserved joint and the cartilage has only local defects. Therefore, we can refill these defects with cells from the cartilaginous tissue of the patient's body. In your imagination, it can look like a pothole on the road that needs to be filled. The cartilage transplantation can be imagined in the same way. During the outpatient visit, the doctor uses minimally invasive arthroscopy to take the cartilage cell from the patient's body. Then it is cultured from 6 up to 8 weeks until the tissue volume that is ultimately needed to fill and close the defect will be reached. The next step is the second outpatient arthroscopy, during which these cells are injected in the damaged tissue. If the meniscus is damaged, you can use it. Meniscus is quite different. Meniscus injuries are generally easier to treat. If the person has a meniscus rupture, they will ultimately develop classic symptoms of displacement with irritation of the joint capsule. In this case, it is relatively easy to help the patient. You just have to perform an outpatient surgery to arthroscopically remove the parts causing damage to the joint tissues, i.e. causing pathological symptoms. This applies to the patient who has received such treatment very quickly and is likely to have a very quick rehabilitation period. In the field of the shoulder joint, the focus is placed on tendon wear and tear. Due to the specific anatomical features of the shoulder joint, namely due to this acromial process, we all do not have the same anatomical structure. The problem is that for many years the tendon has been wearing off. At an early stage, the process is called a classical impingement syndrome, and at the advanced one, this can cause tendon rupture. This means that due to an active mobility of the shoulder, not arthrosis is the main threat for the shoulder, but negative consequences for the tendon caused by an increased mobility of the joint. These can be also successfully treated with outpatient arthroscopy. In this case, arthroscopy is primarily focused on the formation of a sufficient space between the acromial process and the tendon. At a later stage, if a person has a tendon rupture, we certainly also use arthroscopy and try to attach the tendon to the bone as a model shows. This can restore complete mobility and, above all, the force that is naturally decreased due to the tendon rupture. I will be glad to welcome you in our European Center. Foreign patients can expect the warmest welcome. We maintain excellent interaction and cooperation with Booking Health, which has gained a brilliant reputation and ensures the highest quality of its services.